guys, welcome to my channel. Today I'm in COVID-19 hot tub. I'm doing these interviews with the medical professionals to find out how they're dealing with this pandemic. This is where before you get diagnosed with anything, the doctor will check you in. So I'm gonna find out more details from everyone. Keep your eyes on.
So hi, my name's Rebecca. I'm a medical student at King's College London. I'm in my third year and I've been working at the Leicester Centre. I'm originally from a place called Wakefield up north, and I moved to London just for my studies. I've also lived for a period in Chad in Central Africa before I moved to London. So yeah, I guess I've lived in quite a few places. So I'm in my third year now. 2 more years of medicine, and then next year I'm studying global health as an extra degree. It was really strange because obviously we used to be in a clinical environment, we used to go into placement and things, and then suddenly everything was just put on hold. We were told to stay at home. At that time I had a cold and so did my flatmates. So we're suddenly all asking, oh, do we have coronavirus, like what's going on? We're all fine, thankfully we're in a very lower risk group. So we didn't need to worry about that. But then, yeah, I guess it was a lot of sort of anxiety about all the changes that happened, especially with university. They didn't tell us straight away what was going on. We just decided to all isolate together. So we said, well, we're not going to stay 2 meters apart. So we live in a small flat, so we just all stayed, and we spent 2 weeks. Because originally we were ill, so we did 14 days of self-quarantine. To me it was mostly just excitement to be able to do something, because it felt very frustrating being stuck at home, not being able to go out, not being able to support people. And so I was pleased to have a role within this whole crisis as a healthcare worker. And yeah, I guess there was a bit of anxiety, but as I said, with me and my flatmates, we're all in a group who aren't very much at risk, so we felt more that we wanted to give back. It's been amazing to see how communities have come together and how people have really worked for the good of each other and for the good of the whole population in this pandemic, and that's been really amazing to see as a student and really inspiring as I continue my studies and get to work within this NHS as we go forwards.
I'm a GP in South Southwark in London, and I work at the Tessagel GP Centre. But during the community COVID outbreak, I've been working here at the community COVID clinic in Southwark for part of my time. I've been a doctor for 12, I had to think then, when did I graduate? 12 years. After you graduate from medical school, you become a foundation doctor, which means that you're working and you're paid, but you're kind of the lowest level in the hierarchy in doctors, and you do different jobs, different rotations to get a feel for what it's like to work in different areas like medicine, surgery, general practice, pediatrics. Then after you do that, you can choose your speciality, but I actually spent some time working overseas. So I did a diploma in tropical medicine and I worked in Nepal for a while. Then I did my general practice training for 3 years, and then I went to work in Uganda for a while, and then came back and settled in London and started being a regular GP in London. I'm married to a psychiatrist who sometimes refers to me as patient zero. And we have a lovely daughter who's going to be 2 this summer, and a lovely little dog as well. There is no routine. There's no routine because it depends what my hours are, what my husband's hours are, and then with being a doctor or being a clinician of any kind, you never know what's going to happen, so you can never completely guarantee what time you're going to finish. The hope is that we're finished, we pick up my daughter from nursery, we pick up the dog from the dog sitter, we go home and we have some family time together, and then spend the joyful time that it takes to put a toddler to bed, for those who know. And after that, it's checking emails, doing a bit of work, and then trying to have some quality time with my husband or friends on a Zoom call at the moment, if I can. So it's been even harder because my husband has increased his clinical hours. I've increased my clinical hours. We've increased the amount of time that our daughter has to be in nursery. We're really lucky that her nursery has still been open for key workers, because if it wasn't, I don't know how he would have managed to keep contributing to work. And we're really lucky as well that we've had volunteers help us with the dog and with different things that we just couldn't do at the moment because of increasing the amount of time that we're working. And it also means that even when we're at home and even when I'm not working, I'm working. So my husband was involved in trying to set up a voluntary group of psychiatrists and psychologists to support frontline workers with their well-being. And I was involved in helping to set up the GP COVID clinic. So there was lots of online meetings. So even when we're at home, it's been quite hard to be able to disengage from everything that's been going on. And I think that's been quite hard for our daughter as well. So we've had to instigate some rules around when we're in meetings and when we're using the phones at home at the moment. Something that our daughter's become really conscious of. So she now smacks the phone out of your hand or closes the laptop and says, "Wake up, mummy, wake up, daddy." So that was a real wake-up call when she started doing that. I'm really happy with the service we've set up here because we've put a lot of emphasis on team working. So we work really closely with the nurses and our medical students. We discuss our cases a lot. We reflect on our clinical thinking. So that's really helped me increase my confidence about working in this time, because working with COVID, it's working with a disease that I've never worked with before, that there was a lot of unknown information about. There's new information happening all the time. So it's really important to share that responsibility and to share my thinking with the rest of the team. So that's been a really important part of feeling confident to work in the service. And also making sure that we have the right protective equipment so that all the staff feel safe and the patients feel safe. And there's lots that we've done to try and make everyone feel safe. And we've had some great support from the community as well in helping us make visors and gowns and things to kind of improve the protective equipment that we're able to have. So I actually love working here, strangely enough. Despite the difficult times, I feel like we're offering a safe service, and I enjoy working with the team and working with people I've not worked with before. And I enjoy being able to deliver a really good quality care to the people who do come here. So it's actually really comforting in a time when things can be quite scary.
I'm Flora, I'm one of the nurses working at the COVID Community Hub in Peckham, and I've been working here for a month and a half now. So we're seeing patients who have symptoms of COVID and sort of helping them out. How's my life? Well, everyone's life has been massively affected by COVID, of course. I guess one of the I haven't been able to see my family who live in Somerset, so that's been a big factor. I live with my partner and 2 housemates, so I had lots of social interaction with them, which is nice. They're in different fields. They're all in art. They all work in the arts, so very different to medical stuff. So sometimes can't always discuss all the medical things with them because it's very different to their jobs. I've been a nurse I qualified about 3 years ago now. I've been working in primary care GP practices since I qualified, and then just in the last month and a half I've just been working here at the COVID centre. So we get patients referred from their GP practices. Anyone with any symptoms of COVID, so a cough or a temperature, they will then get a taxi cab. We've got our lovely black cabs, and our taxi drivers will pick them up and they'll get driven here. Once that's after a doctor's done a telephone triage with them, and then we'll kind of have a consultation with the patient in the cab, check out how they're doing, how their oxygen levels are, how breathless they are, and then decide whether they need to go home or whether they need to go to hospital or any medication they might need, and basically try and help them out as much as possible. But it's quite a new environment to be working in with the cabs and everything. We've got a whole procedure of donning, that's getting on all our PPE. That always takes a while, so we have to get on our shoe covers, hat, hairnet, gown, apron, mask, gloves, and a visor as well. So it's quite a lot of gear to be wearing. And then we head out, and then it takes a long time to take that all off as well and clean it properly at the end. So each patient can take a while doing all of that.
Oh.
When I go home, I get in the door and I go run straight up to the shower and get straight in the shower, then put my clothes into the wash, and don't let anyone touch me or hug me or anything before I've had a shower when I get home. Well, maybe it's just been really enjoyable working at the COVID Community Hub. We've got a great team. We've got the doctors, medical students, nurses, and we all really work together, and it's a very nice environment and great team working. In some ways COVID has brought all the medical staff together, and we're working much better together, I think, in a lot of ways than we were before, which is really nice.
I'm Brenda Donnelly, and I'm a general practice nurse in South Southwark. I'm also a strategic education lead for general practice across South East London, and I have the privilege of being a primary care network clinical director in a neighbourhood in South Southwark PCN. I'm actually working in the Leicester COVID community service, and that's obviously for people who we were thinking would be COVID positive. And they wouldn't be able to be seen within general practice, so we would be prepared completely to be able to do it. My role here has been a couple of different roles really. So as clinical lead, as a primary care network clinical director, part of that has been overseeing the service, making sure that the infection control was in and that people were trained and able to do the job properly, and that we would act on the outset what's been going on, how we're going to deliver this, how we're going to prepare it, what kind of staff we need, how are we going to get these staff, and then amidst it all, preparing the place to the environment as well. None of us were expecting a pandemic of this sort of scale at all, and something none of us have ever been prepared for before. And I think when we realised just the scale of this and how it was going to affect us locally, we were very quickly lined up, as it were, and trying to find out what would be the best way to serve our population. So you can imagine for anyone that's not able to see our faces and not able to see our smiles and not able to reassure someone by our non-verbal ways in which we deal with people. So they couldn't normally see us smiling at them and said things were going to be okay. So it was a bit of a learning curve to try and get people to relax whenever they came in, and to realise that how do we consult like that. And it was really good for us as teams to learn to work together. We had a medical student and a GP and a nurse, and each brought their own sort of little bit of what they could do and what they were able to do to that consultation, which was really beneficial.
I just want to say thank you, because I've seen a sense of community spirit both amongst my fellow clinicians and amongst my patients and the wider community, a sense of community spirit that I didn't think was still possible in the world that we live in today. And so thank you, and don't forget how we've had this sense of community in this time. When we go back to normal or whatever that is, let's try and take this community spirit forward together.
Thank you to the general public. Thank you very much for obeying all the kind of instructions that have been given to you. Thank you for being so patient with us as healthcare professionals. Thank you for going out every Thursday and clapping for us. It really, really meant a lot. And thank you for looking after yourselves. We always know that people can look after themselves and finding their own resilience, and just a massive big thank you.
Well, my unsung hero, I think I'd have to say Brenda, our lead nurse here. She's been doing so much work in the background, organising everything, to get this service up and running, and also supporting all of us coming through, particularly the nurses, and giving us lots of confidence and great teaching us lots of great stuff. She does it very much in the background, and always is really good at making everyone feel really confident about themselves and really positive, and really congratulates people every time. Everyone, after they see their first patient, she gives them a clap, and just really is really good at boosting morale, and is passionate about nursing and patients and everything and all of it.
It's been really amazing to see how people within our university have adapted, especially our lecturers. And one of our lecturers is called Dr. Claire Sharp, and she works within King's College Hospital, and she's also the leader of my year. And she's maintained her clinical work, and she's also maintained teaching us. And it's been really inspiring to see how she's sort of, coming off shifts at the hospital, yet still putting in the effort to teach the students. And grappling with all the difficulties of technologies and stuff. So yeah, her and all the other doctors who've been teaching us, particularly coming off night shifts and then coming on to teach students, that's a really big sacrifice for them to make.
So my COVID hero, I would have to say, is my husband, Dr. Stuart Smith, because not only has he, throughout this crisis, not only has he put himself forward to try to help others, by setting up a wellbeing group to support frontline staff, and just throwing himself into every opportunity he could find to help. But he's also been a massive help to me in enabling me to have the capacity to contribute to the work I was doing with setting up the HOP clinic and various other activities, whilst also still being a really attentive and compassionate father to our daughter, and still bringing fun and joy into her life. So he's definitely my COVID hero.
I think the unsung heroes here are the people who, the admin staff, medical students, and the junior nurses, and people who come into this place to work. They were facing their fears, and it was, my goodness, there was a lot of fear about. And as seasoned healthcare professionals, we were probably much more used to dealing with that than anyone else. And so when I look at the young medical students who put themselves forward without recompense, I thought they would be my. It was really hopeful for me, because I thought our health services is safe in their hands, and for the lovely junior nurses that came in here as well, putting their hands up, yes, I'm going to come in too. So they're my, and actually the receptionists, the people who come in here actually who didn't really know what we're putting ourselves up for, but came and helped, and we're all there. And so for all of you, that's who they're my unsung heroes.